Assalamu alaikum. Hello, dear friends. This is one of a series of videos about hospital policies and procedures, which are written instructions on how staff members do different processes. Policies are general rules that govern our performance, and procedures are sequential steps on how we do it, and the responsible person for each step. We can update these rules when we have new standards to follow. In this video, we will talk about the policy of nutrition screening, assessment, and reassessment. For more videos, please visit my Facebook page, Healthcare Quality, and my YouTube channel, Dr. Hassan Kamel. If you like it, please support me with follow and likes. This policy is applied to nutrition department and all dietary services in our hospital. The purposes of this policy are: 1. To identify the patient at nutritional risk. 2. To identify malnutrition risk level. 3. To document the nutritional care plan. 4. To provide continuous and comprehensive nutritional care program. 5. To reassess the patient's nutritional status and the nutritional care plan as necessary. 6. To participate in discharge planning. And 7. To provide the patient or family with information or guidelines to plan their own diet and understand the rationale or the diet being prescribed, adjust patients' activities, and to help them learn how to adjust current eating habits. Definitions: nutritional screening, a rapid and simple process that determines and identifies the characteristics known to be associated with nutritional risk. Nutritional assessment, a comprehensive approach completed by a nutritionist or dietitian for defining nutritional status using anthropometric measurements, biochemical, clinical, dietary, and psychological data. Nutritional reassessment refer to the continuous process of data collection to determine the significant changes on the continuance of needs, nutritional requirements, and the extent of compliance and non-compliance of diet or feeding. Policy statement. 1. Nutritional screening criteria is incorporated in the nursing admission assessment form for all admitted patients. 2. It's conducted within the first 24 hours of admission of the patient or earlier as indicated by the patient's condition. 3. The nutritional screening criteria is done by a assigned nurse according to the following: food allergy, difficult chewing or swallowing, uncontrolled diabetes mellitus, diarrhea for more than 4 days, patient admitted in ICU with improper diet, unplanned change in weight, major surgery, depending on the attached screening checklist with a score as follows: score 0 to 1, low risk; score 2, moderate risk; score 3 or 4, high risk. 4. Patients who are at nutritional risk is identified, referred by treating physician to nutritionist to be assessed and reassessed as needed to promote optimal patient well-being and safety. 5. The nutrition assessment includes the following components: admitting diagnosis associated with malnutrition risk, medical history, diabetes mellitus, hypertension, etc., current and ideal anthropometric measures, diet history, food allergy, eating problems, poor appetite, swallowing impairments, etc., food and drug interaction, body weight status, ability to understand diet instructions, and barrier to learn. 6. If nutrition risk level is categorized as high risk, a plan for nutritional care is documented in the nutritionist clinical dietitian's progress notes. 7. The recommended daily allowance as set by the Food and Nutritional Board of the Nutritional Research Council is used as a guide in nutrition assessment and reassessment. Procedure and responsibilities. 1. Identify nutritional screening criteria within 24 hours of patient's admission to the hospital by the assigned nurse. 2. Predetermined criteria are indicated in the nursing admission assessment form by the assigned nurse. 3. An order for nutritional consultation or dietitian referral are notified by a written referral form by treating physician. 4. Perform and complete the initial comprehensive full assessment within 48 hours of receiving a referral case. Responsible person is nutritionist or dietitian who will obtain and collect data timely and appropriately, analyze and interpret data with standards, identify the nutritional problem, assign risk level of malnutrition, and determine the nutritional requirements per day. 5. Monitoring the potential food and drug interactions of most significant medications. Responsible person is pharmacist. 6. Consult other discipline as appropriate in order to develop a nutritional care plan. Responsible person is clinicians, nurses, speech pathologist, physical therapist, social worker, nutritionist, and dietitian. 7. Document the nutritional assessment and care plan in the clinical dietitian progress notes. Responsible person is nutritionist and clinical dietitian. 8. Perform a nutritional reassessment. Reassess to monitor the effectiveness and appropriateness of the nutritional care plan. Alter nutritional care plan accordingly. 9. Prepare discharge plan as necessary. We have an attachment to this policy, which is the nutritional assessment plan and reassessment form. Approval of each policy is usually done by the preparing person, recommended by the department head, reviewed by the nursing supervisor, and approved by the quality director, medical director, and hospital director. Thank you